This is Mousse Pecci.
Yes.
Pecci. Yeah. He is a handsome 19-year-old, and he's here on his second acupuncture treatment. I know, baby. And he is here because he has a long journey to come here. He comes from Mineola, which is roughly what?
Over an
hour north of us. And he came here as a last resort before euthanasia. And Mom, can you tell us a little bit of Mousse's journey?
Mousse had a stricture in his colon that was preventing him from having bowel movements, and we tried some other options and anesthesia with some different procedures that gave him some temporary relief, but unfortunately things came back and he wasn't able to have bowel movements, so obviously quality of life, we were really concerned. And last week after his appointment, his doctor, his regular veterinarian, had palpated him, and things felt really good in his rectal area, and he was having bowel movements 2 or 3 times a day.
That's after the first
yeah.
acupuncture treatment,
so we
right?
were just thrilled, that he's doing so well, and he's purring and eating, and for him to have bowel movements is just really exciting because the last couple months have been really kind of rough for him. So he's doing great. We're just really happy, and it's nice that he likes coming here and it doesn't hurt him, and he always falls asleep after. So
yeah, it has the effects of a deep tissue massage. That's why he falls asleep afterwards, which is a good side effect, I would say. So he underwent a exploratory surgery, and they did find the thickening on the colon, and they were thinking it was cancer, but they could not find the reason why.
Yeah, and then he had a little pancreatic tumor that he had removed for that as well. He's been through a lot the last couple of months. So.
And at 19, the reason you went through, other than loving him to pieces, obviously, the reason you went through all of this is Mr. Mousse has a distinguished career as a therapy cat.
Yeah, he's just a really tough cat, and I think if it was another cat, sometimes it's not fair for them to go through all this, but he just always pulls through and always keeps going. So we just as long as he's up for it, we've been up for it. So, but just his spirit, he's just a really amazing cat, so we wanted to do everything we could for him.
And I know that your husband was a little skeptical about this issue.
He still is. Yeah, he still is. But
hard to argue with the results.
Yeah,
though.
and and we have been able. The stricture was repaired before with steroid injections. We did get a month where he was having successful bowel movements, but then it came back.
So I guess he's holding on for the month.
He's wondering if, yeah. So he's wondering if.
But if you
what
think
it's
about
related
it,
to, what the success is.
yeah. But if you think about it, this was done without sedation, without
Yeah.
putting his body through any effort, and obviously, giving him just a very low tech, really, treatment. And you're just trying to move the energy on his body so that the pattern of stagnation that he had in there that I felt that is gone. Yeah. So I think it's the traumatic results, and I just hope that he just keeps getting better and better and better.
And and his appetite and everything's super. So and just for us to hear him purr and that he's eating and feeling comfortable, that makes us happy.
And in your line of work, you're a technician,
yeah.
and
yeah.
You've seen how sometimes the options are very limited.
Yes.
It's either specialist or euthanasia, and sometimes, people do not realize there might be a third option.
Exactly.
And it's definitely harmless and at low cost.
Very, yeah. And we don't have to worry about that it hurts him or anything, because, he loves it.
So. Yeah. Well, thank you so much.
Thanks.